Good morning, everyone, and welcome back to another episode of Security Health Plan Academy. Today we have Consumer Sales Executive Team Lead Kay Kissinger here to explain the extra perks included with your Security Health Plan 2022 Medicare Advantage HMO-POS plan. Kay has actually been with Security for 21 years. I'm hoping that's the right number. She is a licensed insurance agent in Wisconsin and is certified by both America's Health Insurance Plans and the Federally Facilitated Marketplace. Kay is going to teach us today about the benefits the rich benefits that is included in our Security Health Plan Medicare Advantage plan. So without further ado, Kay, I'm going to go ahead and toss it over to you.
Thank you, Ashley. Good morning and welcome, everyone. I'm so happy that you're all here taking the time today to learn more about the wonderful benefits that you have being a Security Health Plan Medicare Advantage member. If you do have questions throughout the presentation, if you wouldn't mind putting them in the chat feature, if you're comfortable doing that, or I will be stopping, of course, at the end, seeing if there are any questions. So let's get started right away. Pardon me here. Whenever I say that, I'll get stuck on a slide. All right. First, again, I want to thank you for being a member with us. And we're going to talk about how you can get the most for your Medicare dollar. We know, of course, there are things that Medicare itself covers for your medical and hospital services. But where Security Health Plan also shines is that we also offer some extra benefits. And I want to make sure that you're aware of all the benefits that you have available to you. Also want to let you know that we are continuing to grow as an organization. This last year, we celebrated 50 years as Security Health Plan and business, and we're continuing to grow. We have 60,000 members on our Medicare Advantage plan, including all of you. So again, thank you, and we're going to continue to offer these wonderful plans going forward into the future. So let's first take a look at the provider network. You know, Security Health Plan itself is an HMO, which means that we have a specific network of providers for you to use. But what is great and awesome about our Medicare Advantage plans is you have the flexibility to choose who you'd like to see to receive your health care from. We have wonderful in-network providers, as you can see listed here, the Marshfield Clinic Health System, Aspirus, Dickinson County, HSHS, which is Hospital Sisters Health System, Prevea, ThedaCare. We also have UW Health Systems down in the Madison area, along with Monroe Clinic, Pro Health, and Unity Point Meriter. And then all the way up on the west side of our state, we again have the Prevea. We have some Oak Leaf Medical Centers, and we have a contract with the Mayo Clinic Health System. So I know sometimes people will ask and say, hey, can I go over to the Mayo system? Yes, they are part of our network. So you're welcome to do that as well. Of course, we do have our Marshfield Clinic hospitals and clinic locations there as well. And then as we keep going up the state there, we've got St. Luke's in Duluth. We've got Memorial Medical in Ashland and Essentia Health. So these are just a few of our larger providers. We do have some other ancillary or smaller providers as well, bone and joint, some chiropractic, mental health providers that are in network. So again, these are wonderful providers for you to use. But as I said earlier, you have the flexibility. Maybe you want to see a provider who's not on this list. That's okay. You can do so. As long as they have not opted out of Medicare, you get to choose where you go to receive your Medicare benefits. So make sure that you're taking, advantage of looking at all the providers that you have available to you. This is also great for some of you who maybe winter in another place, get out of the snow for a little bit. You can still see those providers wherever you are. And also just a reminder, you are covered worldwide for both emergency services and urgent care services. So again, this is a great benefit built in. And sometimes I have had people ask me, okay, what if I do go to someone in Arizona or Texas or Florida? Do I have to pay more when I see them? You don't. It's a wonderful benefit, again, of being on our program. So you pay the same whether you're here or you're out of the area, as long as they are a Medicare participating provider. So it's a wonderful benefit, and I hope you all know of this benefit. If not, now you do. So let's take a look at the next benefit here. This again goes over when you're in and out of network, but it also talks about some of the enhancements we made when you're receiving primary care visits. So if you were to go in and see your primary care provider, that could be general practitioner, internal medicine, nurse practitioner, physician assistants, those are all considered primary care. You pay zero on any of our Medicare Advantage HMO point of service plans. Whether you're going in for a preventive benefit or you're going in for another benefit, you again are paying a $0 copay. And once again, whether that's in network or out of network. So again, wonderful services that you have. Next, let's talk about the vision benefit. Everyone does get one free vision or eye exam each year, including the refraction to see if your vision has changed. Okay. If you need a second or third, of course, then that would just be subject to that small office visit copay. And then we also give you dollars towards eyeglasses, whether it would be new frames, new lenses, or both. So depending on the plan that you've chosen with Security Health Plan, if you're on our Esteem RX or Ascend RX plans, you get $135 towards eyeglasses. If you're on our Essence or Spirit plans, you get $175. So again, a great way to get dollars to spend towards your eyewear. Make sure, of course, that you're staying in network for these extra benefits because we want to make sure you're getting the most you can for your dollars. And there are some providers that you may want to check with just to see if there's any additional discounts, again, to stretch out that money for you. If you're unsure if your vision provider is in network, of course, you can ask me. You can always jump online to our webpage, securityhealth.org, or you can always call our customer service department as well. And we'll have the phone numbers up here at the bottom for you. The next benefit I'd like to talk about is the hearing benefit. We do cover one routine hearing exam per year. And again, remember, you're paying the same whether it's in or out of network, okay? And then if you do need hearing aids, here is a really great benefit. You only have to pay $500 per aid. Okay, and you can get up to 2 per year. Remember to stay in the network to get these benefits again, so you can get the full benefit. And if you've ever priced hearing aids, you know that $500 is a very small amount compared to what the full cost is. And again, this is something that's provided for you through Security Health Plan because you're one of our members and we value that. Now let's talk about dental. Oral health care is a very important piece of everyone's overall well-being. And so we looked at that and we decided a few years ago, when we want to make sure that you utilize this benefit as well, you do receive one free preventive dental exam, cleaning, and x-rays at no cost to you. So you don't have to pay any extra for this. Again, make sure you're seeing one of our dental providers. You can either jump online, as the web page is listed here, give our customer service a call, or of course, you can always check with your dental provider to make sure that they take Security Health Plan's Medicare Advantage plan. So again, this is built in with any of our Medicare Advantage plans. Now let's talk about Silver Sneakers. Silver Sneakers is a great way to get healthy, to make sure that you're staying active, and it's also nice for socializing. I know over the last few years, we've socialized in different ways, and that's available too. They do have on-demand videos. They have videos that you can just stream a class so that you can do the workout from home or wherever you are. But if you choose and you'd like to go to one of the facilities that is part of the Silver Sneakers network, you do get a free membership to go to that facility and utilize the equipment, track, whatever it might be at those different facilities. Again, if you're not sure if the facility near you is part of the Silver Sneakers program, give us a call, hop online. If you are a member with us, you should have received a Silver Sneakers card in the mail so that you can use that when you go into those facilities. Again, if you haven't received that or you have questions, let us know. Now, another great benefit that we have is something that we call our over-the-counter benefit. And hopefully, again, you're utilizing this benefit because it's here for you to use. So every quarter, you receive $30 in free over-the-counter supplies, which you get to choose what those supplies are. Now, there's a couple different ways that you can order. One way is, of course, we can mail you a catalog. Although, whenever we update anything, of course, it's not going to be in the print. So the most effective way is to go on to your My Security Health Plan app, something you can do either on the website, on your phone, on your iPad, and you can place your order right on there. And the catalog is on there. So it makes it very easy. It has all your information, of course, and then we ship that right out to your home. There's no cost for shipping. Now, a couple things I just want to make sure you're aware of when placing your order. It's one order per quarter. So let's say you're ordering a few things and you don't use all $30, you use $22, and so you have a remainder. You will not have the ability to use the rest of that until the next quarter. The next quarter, though, it starts over again at $30. So if you are going to place an order, you place one order per quarter. And of course, feel free to use the full $30 allotment. And then everything resets the next quarter. So it's quarter to quarter that you can use that. A few other things that I want to make sure you're aware of is our free preventive healthcare services. So beyond just your head to toe checkup and physical, we also cover the vaccines. Of course, there is no copay for those vaccines at this time, the COVID vaccine, pneumonia, flu, also things such as cancer screenings, mammograms, pelvic exams, colonoscopies. I know that's nobody's favorite thing, but it is a necessary part of keeping your health in line. So we do pay for a colonoscopy at no cost, no copay, no surgical fee. If a person needs home infusion, of course, having a drug infused into the body at home so you don't have to go into a clinic or a hospital, that is also a covered benefit at no cost. So no out of pocket, no copay. The third one here on the right side, it says drugs received in an observation stay. Now, you may not know what that means, but if a person were to go into, say, the emergency room and they're being evaluated, not sure yet if they're going to be admitted into the hospital or put in what they call an observation status. Well, any prescriptions that you are given during that time are not paid for by Medicare, but Security Health Plan has chosen to pay for those prescriptions because you're one of our members. So that's another great benefit, something you don't have to worry about when you're in the middle of that situation. We also have our 24-hour nurse line and our Care My Way. These are great benefits. So maybe you have something going on and you're just not quite feeling right. Please call the nurse line. Depending on what the conditions are, your symptoms, they may connect you with Care My Way, which is where you can speak with one of our nurse professionals and they can walk through your symptoms. And depending upon what they are, they could even put a prescription in for you at the pharmacy, saving you a trip to the doctor and having to wait. The prescription will already be waiting for you at the pharmacy. And again, this has no cost involved. All of these things are ways that we're trying to keep you stay healthy. We also have some care management programs with our care management team. So some of you may have received things in the mail asking if you're interested in a Healthy Hearts program or diabetes management. Again, these are all things we're trying to do to keep you in the best health that we can. And again, at no cost to you. A few other things of why you may have chosen Security Health Plan. And as you evaluate each year, keep in mind these are things that we know are important to you. So we want to make sure that we continue offering these for you. The first one we just went through, the vision, the hearing, the dental, the over-the-counter, and the silver sneakers. Those are great benefits provided that we provide beyond Medicare. The second I mentioned before was the zero copay for primary care. And you can go anywhere that accepts Medicare. So you pay zero whether you're here or you're away. A reminder again, emergency and urgent care is covered worldwide, even if you're out of the United States. And then the fourth one listed here is those vaccines, the diabetic testing supplies, the colonoscopy, all those that I just went through, and more, cardiac rehab benefits. Other plans don't always offer these benefits at no cost to you. So again, it's important that you know that these are provided for you. And then the fifth one is you have the flexibility to choose what's right for you each and every year. Maybe your medical situation changes, maybe your financial situation changes. You know that each year during the annual enrollment, which is October 15th through December 7th, you can make a plan change if you want to. But also know if you're satisfied with the plan and you choose not to make any changes, that's great. We will continue to provide the same level of care for you. You do not have to call in and re-enroll into that plan. And then the sixth one listed here is also important. You do not have to be hospitalized for any amount of days, 1 day, 3 days, before you receive coverage for skilled nursing care. The reason why we bring this up is with Medicare itself, there is a regulation that says how many days you have to be in before you can go to that next level of care. Well, we waive that rule. We make it determined on what you and your providers state is the next course of action for you. So again, taking away any barriers of getting the health care that you need. All right, so to get answers to your questions after today, again, you can go online, securityhealth.org/Medicare22. As I mentioned, if you have the My Security Health Plan, it's a great feature. I use it myself, of course, because I have Security Health Plan. You can also chat online. If you want to speak with a customer service representative, you can check and look at your explanation of benefits or statements. Premium information is out there. And again, the over-the-counter catalog. So it's something that's really handy for you to have. But of course, as always, you can call us. We're local. It's a big part of who we are at Security Health Plan. We're just friends and neighbors helping each other out. So you can always give us a call. The number's listed here. It's also on your ID card. Okay, and that's a reminder of the hours there. Or if you work with a broker, an agent who is contracted with Security Health Plan, feel free to reach out to him or her as well, and they can assist. I want to thank you for your time this morning, and now we're getting close to the afternoon. And of course, if you have any questions, I'm here to help.
All right, thank you so much, Kay. We did receive one question via the chat feature. And the question is, are the diabetes testing supplies in the OTC catalog?
Okay, good question. The diabetic testing supplies are not in the OTC catalog. The testing supplies is just part of your medical benefit. So those are covered at no cost. It does not go toward your $30 over-the-counter credit. So if you need testing supplies, Lancets, whatever the case may be, you can just go ahead and get those from the pharmacy itself. You don't need to order those through the OTC.
Okay, another question. Is the shingles shot covered?
Another great question. The shingle shot, or Zostavax is the, I guess, the patent name for it, is covered on our plans if you have Part D included, which means your plan would say RX at the end. So the Esteem RX has it, the Ascend RX, the Essence RX, and the Spirit RX. So again, if your plan has Part D built in, that is a covered benefit at no cost or copay to you.
Okay. Another question just in. Does the health plan cover observation status?
Great. Yes, it does cover, observation status. And in case some people are not familiar with that, again, that's when you're kind of in between. So maybe you're not needed in the emergency setting anymore, but you're not quite admitted into the hospital. So they're observing you. You may need to have maybe a scan, MRI, things like that, labs. Those things are covered. Now, they will be subject to the copays that would typically apply if these were done in an outpatient setting, but they are a covered benefit.
I'm going to say this wrong. I think it's Zostavax. How is that how you said it?
Yep, it's okay.
Is the older shingle shot. The new one is Shingrix. It requires 2 injections. Is this covered?
Yes, another good question. Yes, both are covered. The Zostavax, which is the older one, and the Shingrix, which is a 2-step. They're both covered. And again, no cost, no copay, as long as you have the Part D portion of that plan.
Okay. I think this is in follow-up to our initial question. My pharmacy stated I needed a prescription for my diabetic testing supplies. So do I need that with Security Health?
That's a good question. You do need a prescription from your provider. So whoever you're meeting with regarding, that condition, and what they do is they send that right to your pharmacy. And then when you go to the pharmacy, you can pick up that prescription, but that does need to come from the provider.
Okay. Another question. My husband has regular Medicare and supplement. Can Security Health provide prescription coverage to someone who doesn't have or who does not have a regular Security Health plan medical plan? I'm guessing is what that.
Okay. My assumption, and you can tell me if I'm wrong, is that you're wondering, do we have a standalone prescription drug plan to go along with their Medicare supplement? Unfortunately, we do not have that. However, what I always encourage you to do is take a look at the cost you're paying for your supplement in premium, because supplements are typically, of course, also age rated. So take a look at that and what you're paying for your prescriptions versus maybe one of our Medicare Advantage plans that has that all rolled into one. And it's kind of nice too, because then you get one card, one premium, if there is a premium, because as you know, we have $0 plans that include the drug. But getting back to your question, we do not have a standalone drug plan.
Thank you. I received a letter from Security Health telling me I can't go to my current primary care provider anymore. How do I find a new primary care provider?
Sure. And I know that we do, sometimes there are providers that retire or move, or they're no longer able to take the same patient load. To find a new primary care provider, we can either have one of our care managers assist you, or if you're going to the same, let's say you're going to Marshfield, right in Marshfield, the clinic there, if you call that same department, let's say it's internal medicine, they can let you know who is accepting new patients, and they can assist you get reestablished as well. So I typically say start with your provider, and then if you do need assistance beyond that, then our care management team can step in and help.
Perfect. So I am going to just hang on just a minute here to see if any other questions come through. I just want to let our audience know that we are recording this presentation and we'll be sharing in the follow-up communication a link to the recording. I believe that's scheduled to go out later this month, so keep your eye out for that communication. Any last minute submissions? Ooh, and I actually want to note as well that let's say you're sitting here today, you don't have a question, and then you leave and think, oh my gosh, I have a question and it's too late. Well, it's not too late. You can always submit a question or reach out to us and we can connect you with Kay to get that question answered.
Yes, and I'll go back here to the different ways to contact us as well. Thanks, Ashley,
Perfect.
for that reminder.
Yes. Okay, I think with that, we can go ahead and close a little bit early. Thank you so much, Kay, for your time today. And be well, everybody.
Yes, thank you all. Take care.